Thank you, Phoebe, for talking about barrier and methods with everyone. For the next portion, we're going to move on to the C's of pregnancy, which the C stands for contraceptives, and contraceptives are defined as any new method or device used to prevent pregnancy. Some of the contraceptive methods we are going to learn about include the birth control pill, the birth control implant, intrauterine devices, the birth control ring, and the birth control shot. First up, we have the birth control implant. The birth control implant is a tiny rod inserted underneath the skin of the upper arm. Its official name is Nexaplanin, and it releases a hormone named progestin that causes the cervix to produce some mucus that prevents the sperm from reaching it. It also stops the eggs from releasing, which prevents the sperms from even reaching the eggs in the first place. This method is 99% effective, and it can last for up to 5 years. It does have to be implanted by a health professional. It doesn't really hurt too bad. You get a numbing shot, so that kind of numbs the area, and then they go ahead and insert it into your upper arm. And then there are some slight bruising usually that does occur after, but other than that, there hasn't been, through the research I did, there hasn't been much effects other than that. And if you want it removed, you just have to go back to that health professional, and it is kind of the same procedure. You get a numbing shot so you don't feel most of it, but it's an easy removal process if you decide that it's not right for you. Next, we have a video that kind of describes the birth control implant and shows exactly where it's inserted.
Effective kinds of birth control you can get. It's a tiny matchstick-shaped rod that releases the hormone progestin to prevent pregnancy. A doctor inserts the implant under the skin in your upper arm, and that's it. You're protected from pregnancy for up to 5 years. The implant is super convenient and mistake-proof. You get it, and forget it. A doctor can remove your implant anytime you want, and your ability to get pregnant quickly returns. The implant has possible side effects, but they usually go away in a few months. It has benefits too, like easing period cramps. The implant doesn't prevent the spread of STDs, so use a condom along with the implant to help protect yourself. Want to get the implant? Your nearest Planned Parenthood Health Center is here to help.
Okay, and next up we have the birth control pill. This one is a pretty common one, so you might have heard of it in the past as the pill. It is 91% effective, and you do have to take it every day. It's a small pill though, so you just swallow it every single day around the same time. It is recommended that you use a timer app to keep on track with that, just to make sure you don't miss a day. It is really important that you take it daily. You also need a prescription from a provider, so you'd have to have an appointment to set up that, and then they would give you a prescription. There are many different types of birth controls and brands, and it's really important that you talk to your healthcare provider because they can find exactly the right one for you and minimize any side effects that you may be experiencing on one brand and switch you to another one. So you just need to bring that prescription to the pharmacy and then get it, and then just make sure you get it for every month so you can take it every single day. Here is a little video that describes the birth control pill.
The birth control pill is safe and super simple. You swallow one tiny pill every day, and that's it. You're protected from pregnancy. But you have to take it every day, so use an alarm or app to help you remember. And the pill doesn't prevent the spread of STDs, so use condoms along with the pill to protect yourself from both pregnancy and STDs. Like other medications, the pill has possible side effects, but they usually go away in the first few months. It has lots of benefits too. The pill can clear up acne, ease cramps, and make your periods lighter and more regular. Want to get on the pill? Your nearest Planned Parenthood Health Center can hook you up.
Okay, and next we have the birth control ring. The birth control ring is inserted inside the vagina and lasts 3 to 6 weeks. So this one releases 2 different hormones that prevent the eggs from releasing so the sperm cannot reach them. This one you need a prescription for as well, so you get that from your healthcare provider, and then you take it to the pharmacy and you get one, and you actually are able to insert it yourself. You just have to ensure that you insert it regularly and correctly. It is very important that you do so. So it is recommended if you do this birth control. It's also called NuvaRing, but if you use this birth control method, that you make sure with your healthcare provider that you know exactly how to insert it and how long you can go without inserting a new one. Next, we have intrauterine devices. These are also called IUDs for short, since it is kind of a mouthful to say. These ones are really cool because they can be hormonal or non-hormonal. The hormonal ones can actually reduce period symptoms, making them lighter and making less cramping occur. The hormonal one is a copper IUD, and copper actually naturally deters sperm away from the egg. So there's no hormones, it just uses the power of copper. That one is really cool too because it can be used as an emergency contraceptive up to 5 days after unprotected sex. So if you get it inserted up to 5 days, it can prevent a pregnancy from occurring after unprotected sex, which is really awesome. They last 3 to 12 years depending on which one you choose, and they do have to be inserted by a healthcare provider. It's not super invasive, you don't have to be under anesthesia, but you do have to take potentially some numbing pills or insert cervical softeners to kind of reduce the pain. There is cramping usually that occurs, but it only lasts for about a day or two after insertion, and then you can forget about it for about 3 to 12 years apart from an annual checkup to make sure that it's in place. So these are pretty low maintenance. Next, we have the birth control shot. The birth control shot is, it can either go one of two ways. If you're afraid of needles, then you probably would not enjoy it. But if you don't mind needles, it's pretty low maintenance. You just get it once every 3 months, I mean. So you only have to have it 4 times a year, so it's pretty low maintenance. You just go to your healthcare provider office and get it on a regularly scheduled intervals. It is very important that you get it on those intervals because they will be less effective as time goes on. There will still be a little bit, but just to be sure, you want to get it on time every single time. It's just a little prick, doesn't hurt too bad, but it does need to be inserted by a healthcare provider. Can't just do it at home. It's 94% effective, and like I said, 3-month cycle, so it'll last for 3 months every single time. Here's a short little video on it, just to show about its benefits and how it works.
The birth control shot is safe and convenient. One little shot every 3 months gives you great pregnancy protection. That means you only have to think about birth control 4 times a year. The shot uses the hormone progestin to prevent pregnancy, but it doesn't stop the spread of STDs, so use a condom along with the shot to help protect yourself. Like other medications, the birth control shot has possible side effects, but they usually go away in a few months. It also has plenty of benefits, like making your periods lighter, or even making your periods stop altogether while you're on it. The shot is private. Only you and your doctor need to know you're using it. And it's super effective as long as you get your shot on time, every time. Want to get the birth control shot? Your nearest Planned Parenthood Health Center is here to help.
And so as you probably noticed, with all of these contraceptive methods, it is recommended that you do use barrier methods in addition to using them because none of them are 100% effective. So for this next portion, we are going to be doing a quiz just on some contraceptive and barrier methods to refresh your knowledge and go over a few last minute things before we move on to the D's of pregnancy. So our first question is, we gotta wait for it to load. This birth control method includes taking 1 pill every day around the same time. It contains hormones to prevent pregnancy and is 91% effective. The options are intrauterine device, condom, birth control pill, and birth control implant. And you have 30 seconds to answer, so take your time if you need to think about it for a minute. And then we'll see. And also when you answer these, at the end there will be a scoreboard that shows who won, so it's kind of a fun competition. And yes, the correct answer was birth control pill. You guys did awesome. Thank you so much for participating. But the key for this one is that you take 1 pill every single day around the same time. So that was the big kind of hint for that question. All right, moving on, we'll do question number 2. This birth control method prevents pregnancies and STIs. This covers the penis by placing a soft plastic pouch within the vagina. The options are intrauterine device, condom, roll-on and internal, sponge, and diaphragm. Okay, great. Yep, condom, roll-on and internal. The hint here is the soft plastic pouch that is put over the penis, and that prevents sperm from even entering the vagina. Question number 3. This birth control method is inserted into the uterus and can be hormonal or non-hormonal. This method can last 3 to 12 years. The options are intrauterine device, birth control pill, birth control ring, or birth control implant. And so you can pick one of those. Awesome, intrauterine device, you guys got that again. Like I said, the hint is hormonal or non-hormonal because we went over that. And then also that it can last 3 to 12 years because that's a pretty significant time. Question number 4, we're almost done with the quiz. Great job, everybody. This is a chemical placed into the vagina that blocks the entrance to the cervix and slows the sperm down. The options are cervical cap, sponge, diaphragm, and spermicide for this question. Awesome, you also got that right. Spermicide is correct. And the key word for here is a chemical placed in that slows down the sperm, which is the key words that kind of emphasize the one that it is, okay? And we're on our 5th and final question. And like I said, after this, a leaderboard will be shown. This birth control method is inserted underneath the skin of the upper arm. It releases a hormone named progestin to prevent pregnancy. The options are intrauterine device, birth control patch, birth control implant, or birth control ring. Awesome, you got it, and you got them all right today, guys. Great work. It is birth control implant. And here's our leaderboard. Katie won. You did awesome, Katie. Good job. Thank you so much, everyone, for participating. I hope that kind of sticks with you and shows, the keywords that you can use to remember these different types of barrier and contraceptive methods. Next, we will have Gabriella discussing the D's of ABCs of pregnancy. Thank you so much.